Hello, and welcome to the Golden Wellness Guide podcast, your trusted companion on the journey to living well, staying healthy, and aging wisely through life's golden years. I'm your host, an expert from Golden Wellness Guide. For years, in our work with the senior community, we at Golden Wellness Guide have noticed a common belief, an idea that sounds perfectly reasonable. To stay healthy, we need to do more tests, more screenings, more interventions. We're encouraged to be proactive, to get ahead of disease. But today, we're here to discuss an idea that is perhaps even more powerful. An idea that can transform how we approach our health after the age of 70. And it's this: wise healthcare doesn't mean doing more. It means doing the right thing, at the right time, for the right reasons. And sometimes, the strongest and wisest decision is to take a deep breath and say, hold on, let's rethink this. In today's complex medical world, being an informed consumer, being the person in charge of your own body, is more important than ever. That is our mission at Golden Wellness Guide, to give you clear, evidence-based information so you can confidently sit in the captain's chair, steering the ship of your own health, especially as we navigate the less familiar waters of our 70s, 80s, and beyond. In today's in-depth podcast, we're going to explore a crucial topic: a few common health screenings whose benefits may no longer outweigh their risks as we age. We won't just say what to avoid, but we'll dive deep into the why. And most importantly, we will equip you with a toolkit for having effective, confident conversations with your healthcare providers. This will be a longer, more detailed conversation, because we believe you deserve the full picture. Think of this as an investment of your time in your own health and peace of mind. So please, get comfortable, and let's begin this journey together. Before we break down specific tests, the most fundamental thing we need to agree on is that the rules of the game for our health have changed. Imagine your health is like a car. In your 40s, it's like a race car. You put the highest octane fuel in it. You maintain it aggressively. You're ready to replace parts at the slightest sign of wear. The goal is maximum performance and speed. But when you enter your 70s or 80s, your body is more like a classic car, a cherished vintage Rolls-Royce. You wouldn't drive it recklessly down the freeway. You wouldn't fill it with rocket fuel. Your goal now is to keep it running smoothly, to preserve it, and to enjoy the ride in comfort. You maintain it gently, intervening only when absolutely necessary, because you know that a clumsy repair could cause irreparable damage. Our health goals shift in the same way. We move from maximizing lifespan at all costs to maximizing quality of life, independence, and joy in the years we have. Once we understand this foundational shift, we can clearly see one of the biggest traps of modern medicine for older adults: the testing cascade. It works like this: you get a highly sensitive screening test. The test picks up a tiny abnormality, a shadow, something that, 9 times out of 10, is harmless, just a scar of time. But that abnormality plants a seed of anxiety in your mind and your doctors. What if that seed sprouts into a series of follow-up tests, each one a little more invasive and a little riskier? Ultimately, you might undergo a biopsy or surgery to remove something that was never going to hurt you in the first place. The result? You've traded weeks or months of anxiety, pain, recovery, and possibly long-term complications, all for peace of mind from a threat that was tiny, or maybe never even real. This is the phenomenon of overdiagnosis. It finds clinically insignificant diseases and turns healthy people into anxious patients. The older body also has its own physical realities. Recovery is slower, organs are more sensitive. Anesthesia that you sailed through at 60 might leave you with brain fog for weeks at 75. A contrast dye that was harmless to a younger person could injure kidneys that have been working hard for 8 decades. Grasping this mindset, the mindset of the proud owner of a precious classic car, is the compass that will guide all our future medical decisions. From now on, we won't ask, Will this test find something? Instead, we will ask, will finding that something actually improve my life? Or will it just make things more complicated? With that compass in hand, let's navigate a few familiar but treacherous waters together. Let's start with the routine colonoscopy. And let's be clear, the colonoscopy is a fantastic tool that has saved millions of lives. For someone in their 50s and 60s, it truly is the gold standard for preventing colorectal cancer. But any metal, even gold, can be worn down by time. After age 75, especially for those with no symptoms and a history of normal colonoscopies, the shine of this gold standard begins to fade, revealing sharp, risky edges. Let's break it down realistically. First, the prep. Anyone who has been through it knows it's no picnic. But for a 75 or 85-year-old body, it can be a true ordeal. The dehydration and electrolyte imbalance can cause dizziness and weakness, significantly increasing the risk of a fall, one of the most dangerous events for an older adult. A fall in the bathroom in the middle of the night can lead to a hip fracture, which can be the start of a long, irreversible decline in independence. Then there's the post-anesthesia fog. Brain fog after surgery is real. For older adults, this period of confusion, temporary memory loss, and lack of focus can be prolonged, deeply affecting quality of life and causing significant distress. And finally, there is the find and destroy trap. A colonoscopy might find very small polyps. Our instinct is, if you see it, you have to remove it. But many of these polyps grow so slowly that they would never become a threat in a person's remaining lifetime. Yet the act of destroying them carries immediate risks like bleeding or perforation. We are trading an immediate, tangible risk to eliminate a distant, uncertain future risk. So, what is the wiser path? Become a sharp observer of your own body. Pay attention to real changes, unexplained weight loss, a sudden and lasting change in bowel habits, or blood in your stool. These are the real red flags. If you see them, see your doctor. Also, you can explore gentler options. Newer, non-invasive stool tests are an excellent way to screen for colorectal cancer without the risks of a full colonoscopy. They can help identify who actually needs to proceed with an invasive test. Next, let's talk about the full body scan. The promise is so seductive. Find everything before it's too late. It plays on our deepest fears and sells us an illusion of total control. But the truth is, for an older adult, it's often a one-way ticket onto the testing cascade. Why? Our body is a living diary of our time on Earth. It's filled with incidental findings, old scars, harmless cysts, spots of wear and tear. A hypersensitive scanner will document all of them. It can't tell the difference between a harmless memory and a real threat. But once it's printed on a report, a shadow on the lung, or a lesion on the kidney becomes a suspended sentence. The hard truths about full body scans are that they create more problems than they solve. The radiation risk is real, and it is not evidence-based medicine. The wiser path is smart screening, not blind screening. Focus on the targeted screening methods that have been proven effective. The best medicine is targeted. When you have a symptom, your doctor will use imaging to answer a specific question, not just cast a wide net and see what they catch. Peace of mind doesn't come from a clean report from a machine. It comes from living a full life and trusting the wisdom of your body. Finally, let's discuss the cardiac stress test. It's a familiar tool, but for a heart that has already beaten over 2.5 billion times, the definitions of limit and normal are very different. Using this test for routine screening in older adults without symptoms often leads to misleading results or false positives. An older heart has natural changes that a machine can misinterpret as signs of disease. A false alarm often leads to the slippery slope of intervention, starting with an invasive angiogram and sometimes ending with a stent to fix something that wasn't broken. For stable coronary disease, major studies have shown that this kind of intervention is no better than optimal medical therapy. So what is the wiser path? Trust the real-world stress test. The most important question isn't, what does the treadmill say? It's, can I climb 2 flights of stairs to visit my daughter? Can I walk around the block with my friends without chest pain or unusual shortness of breath? Your ability to function in your daily life is your most reliable cardiac indicator. Invest in the foundation of heart health, and act for a reason. If you begin to experience new and concerning symptoms, that is the time to see your doctor. Knowledge only becomes power when you use it. This final section is about turning this understanding into action in the doctor's office. In our culture, questioning a doctor can sometimes feel like challenging authority. But we believe you are not a passive passenger on your health journey. You are the captain. Your doctor is the navigator, the expert guide who knows the charts. But the final decision about your course must be yours, based on a combination of the navigator's advice and your own values and goals. To help you sit confidently in that captain's chair, always bring these 5 golden questions with you. Golden question number 1. Thank you for that suggestion, Doctor. For someone my age and in my specific situation, is this test truly necessary? And do its benefits really outweigh the potential risks for me? Golden question number 2. If we go ahead and the test finds something, what does the bigger picture look like? What are the likely next steps? Golden question number 3. Is the result of this test likely to change how we manage my health? Or is it more for informational purposes? Golden question number 4. Are there any gentler, less invasive options we could consider first? And golden question number 5. What if we choose the option of watchful waiting for now? What is the most realistic scenario we might face? Asking these questions doesn't mean you distrust your doctor. On the contrary, it shows that you are a serious, engaged patient who wants to be a true partner in your own care. We have covered a lot of ground together today, on a journey to redefine what healthcare means in our golden years. At Golden Wellness Guide, we believe it's not a war against aging. Aging is not a disease to be cured. It is a natural season of life, and it can be the most beautiful and meaningful season of all, if we know how to navigate it wisely. That wisdom lies in recognizing that our bodies deserve to be treated with kindness and respect, not constantly prodded, tested, and intervened upon. It lies in shifting our focus from the fear of illness to the joy of wellness. It lies in trusting our body's resilience and listening to the messages it sends us every day. And most importantly, that wisdom lies in recognizing our right and our responsibility to make our own choices. You have the right to be informed, the right to ask questions, and the right to say no to anything that doesn't align with your values and your life goals. We hope this conversation has given you not just information, but also confidence and inspiration. Confidence to speak with your healthcare providers as an equal partner, and inspiration to live a full and vibrant life, one that is not overshadowed by health anxiety, but is illuminated by joy, connection, and meaning. Thank you for spending your valuable time with us. If you found this conversation helpful, please share it with your loved ones, because the greatest gift we can give each other is the wisdom to live better. From all of us at Golden Wellness Guide, we wish you a life filled with health, joy, and peace of mind.